Hello everyone, this is Dr. Sakamoto. On this channel, I provide in-depth explanations of regenerative medicine and other medical topics. Please kindly subscribe to my channel. Today, I will present a case report on stem cell therapy for meniscus tears and osteoarthritis of the knee. She had been consistently playing volleyball for about 15 years. Around that time, she started experiencing locking symptoms in her knee where it would suddenly get stuck and she couldn't straighten it. Locking symptoms occur when the meniscus in the knee is torn and a fragment of the torn cartilage gets caught in the joint during movement. She mentioned that after experiencing the locking symptoms, the pain would subside after a while and she could return to her daily life. So she didn't go to the hospital and left it untreated. However, the pain gradually increased and the frequency of locking symptoms also increased. Just when she was thinking she might need surgery, she found our clinic's website and came to see us. These are her MRI findings. The MRI findings show a slight narrowing of the joint space on the medial side, and you can see bone spurs like this. This is another additional MRI finding. The MRI specifically revealed a horizontal tear in the posterior horn of the medial meniscus. As you can clearly see, there's a white horizontal line distinctly visible and quite evidently visible on the MRI scan. It's most likely that the large horizontal tear caused the torn meniscus to become trapped in the joint, leading to the locking symptoms. We administered cultured stem cells that had not been frozen to this patient's knee twice. The effects started to show about a month later, and after around 3 months, she mentioned that almost all the pain had gone away. Since then, she hasn't experienced any locking symptoms at all, and she was very happy. We believe that by injecting live, unfrozen stem cells, we can achieve high levels of repair and regeneration, even for large meniscus tears like hers. Regarding cartilage regeneration in osteoarthritis of the knee, treatment outcomes are significantly better when treatment is initiated in the early or middle stages, while cartilage is still present rather than in the late stages. Today, I presented a case report on stem cell therapy for meniscus tears and osteoarthritis of the knee. Thank you for watching the video.